What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason, probably not going to change. Slowly recovering from this wicked head cold super infection. Starting to get the voice back. Still talking all nasally still, so you're going to have to deal with that, sorry. Thought-provoking question today. Don't know why I thought of this. Popped into the front of my skull today, and I thought I'd propose it to the tribe. What are your thoughts on nurses and tattoos? I will preface this by saying that I am a nurse, and I have several tattoos. This is just a general question out there of, what are your thoughts on nurses having tattoos? Or what are your thoughts on nurses having tattoos that are visible when they have scrubs on? And this could be anywhere. I mean, I'm thinking in terms of like the tattoos on the sleeve tattoos or tattoos on the forearms. And I mean, if you really want to have tattoos on the hands, sure. Tattoo on the forearms, tattoo anywhere that's visible when you're wearing your scrubs. I mean, if we want to play devil's advocate here, we could talk about tattoos on the neck. We could talk about tattoos along the neckline. The topic always comes up when we discuss nurses or healthcare professionals in general possessing tattoos. Is that professional? Are tattoos professional? Does a healthcare professional, and we'll just say nurses, do nurses with tattoos come across as less professional? I, as a tattooed nurse, will argue that no. I don't believe tattoos make you less professional. I also strongly believe tattoos don't dictate the level of care you provide. Just because I have a tattoo doesn't mean I'm going to give less quality care than my coworker who doesn't have tattoos. Here's the rub though. Public's perception is their reality, and while I am all for people wanting to express themselves in however way they want to, where do we draw the line? Where do we draw the line of professional attire versus personal expression? I am not passing judgment on anyone because, once again, I possess tattoos. But I have chosen not to have tattoos that are exposed while I wear my professional attire, which is basically my scrubs. Although we could sit and argue about how scrubs became professional attire. Aren't scrubs just pajamas? Things that make you go, There are certain individuals that are not accepting of tattoos on the professional. Nurse, healthcare professional, physician, nurse practitioner, so on and so forth. Where do we draw the line, and where do we say you can have this, but you can't have that? Is it an all or none blanketed concept, or are we to have differences and specifics? For instance, I know that in certain facilities that I previously have worked in, if you possess tattoos that are exposed, wearing a sleeved shirt, sleeved scrub of any kind, that you have to wear something to cover your tattoos on your arm, your upper arm, your forearm. I'm curious as to what everyone else has to say because I have my own personal beliefs, but this isn't just about us. This is also about our patients. We could extrapolate this to, Press Ganey scores. Stab myself in the eye on that one. But the reality is, patient's perception is their reality. I think everyone can agree that tattoos don't dictate care. Once the patient actually speaks to the tattooed nurse, they'll realize that the tattoos don't make the nurse, and the lack of tattoos don't make the nurse. It still seems to be a topic of discussion, or a very sensitive topic, and I'm curious as to what the tribe has to say. I'll leave you with a quote that I heard a long time ago. It means a lot to me as a tattooed nurse. It goes something like this. Do you know what the difference between a tattooed and a non-tattooed person is? The tattooed person doesn't care that you don't have tattoos. What'd you think of this one? Want to hear your thoughts. Tattooed, not tattooed? If we have tattoos, are you okay with any kind of tattoo from the neck up to the fingertips? Or should we keep it professional and not have tattoos that go past the sleeve? Once again, I'm not judging because I have plenty of professional colleagues that have tattoos that go all the way down to their wrist. I would want them saving my life. I would want them caring for my family member. I don't judge when it comes to tattoos, but this isn't just about me. I want to hear what you have to say. Inquiring minds want to know. Always want to hear from you. Leave me a comment down below. Always appreciate a thumbs up. Your comments are my caffeine. Share this with somebody. And as always, check your own pulse first.